To swaddle or not to swaddle? That is the question. Back in the day, almost all babies were swaddled. But over the past couple of decades, the swaddling or not swaddling has been hotly debated as we're looking at how to increase safety during sleep time. So we decided that we were going to look at all the evidence, go to all the best sources, and figure out what is the true information and pass that on to you guys. So today we're going to talk about the effects of swaddling on crying, pain, preterm babies, hip development, risk of sudden infant death syndrome, or SIDS, breastfeeding, and sleep. And at the end, we're going to give you some tips and tricks on how to swaddle your baby safely if you choose to do so.
If you want more great info on pregnancy and postpartum, then subscribe here. Please make sure to read the disclaimers below and check out our website for more great information at www.shefoundhealth.ca. Also make sure to follow us on Instagram at she.found.health.
We take care of so many newborns and hear all the challenges that new parents have with babies' sleep. I, for one, swaddled both of my babies, and they were both pretty reasonable and still are very reasonable sleepers. What about you, Sarah?
I've had 3 babes, swaddled all of them.
So obviously, you can tell our opinion, but we really want to go through the evidence for you so you can make your own decision on what you want to do.
So Alicia, let's look at the evidence. First off, for crying. We know that for babies that cry excessively, and sometimes this can be described as colicky, swaddling is actually more effective at decreasing crying than massages in infants.
So probably a really good time to use this, and I know everybody knows about the witching hour, those few hours from 5 p.m. till 10 p.m. when your baby is just fussy for no good reason. You can feed them, that doesn't make a difference, you can hug them. They're just overtired and don't know what to do with themselves. This would be a great time to use a swaddle. Go into a dark room, swaddle them, rock them, and then just put them down for a nap in the evening.
Absolutely.
Also, probably that would allow you to have a nice dinner with your partner as well. What about pain? So we know that for swaddling, it doesn't make that much of a difference between another non-pharmacological or non-medicinal management for pain. So for pain, we don't think that swaddling is necessarily an appropriate choice.
So what about preterm babies? So babies that are preterm are babies that are born before 37 weeks of gestation. We know that preterm infants, when swaddled, have shown improved neuromuscular development, less what we call physiologic distress, better motor skills and organization, and they're more able to self-regulate when they are swaddled.
So really good for preterm babies. And you'll really notice that when you go into the neonatal intensive care units, that all of those babies are swaddled, or most of them are swaddled. They're fed, they're swaddled, they sleep, they wake up, they feed, they're swaddled, they sleep, they wake up.
They're amazing, the routines they have them in.
It's pretty incredible. One of the issues that we do know about swaddling is hip development. So there's developmental dysplasia of the hip, and this is when those hips are not allowed to open up. So the legs can't come up and they can't spread out. So one problem with swaddling, if you do it inappropriately, is you can swaddle those hips really tight, and that can cause them to have developmental concerns. So this is a really important point, and we'll get to this later, is when you do swaddle your baby, you want to have a nice snug top, but loose legs. And so there's some great swaddle sacks out there that we'll link to below that you can use to achieve this purpose.
And that's what I used with all my babies. I'm not a skilled swaddler.
I did both, but certainly the bags were easier.
Another question we get a lot of, and we know that there's a lot of concern around, is the risk of SIDS, sudden infant death syndrome. So we know that swaddling promotes favorable sleep on an infant's back position. We know swaddling in combination with a baby sleeping on their tummy can increase the risk of SIDS. The baseline risk of this is about 1 in 10,000 infants. So the risk is low, but it's not a risk that we would be willing to take. So we recommend not swaddling infants if they're sleeping on their tummies, or for any infant that is getting ready to or is able to roll over.
And so the rolling usually happens about 4 months of age is when the normal developmental milestone is. So we usually recommend stop swaddling around 2 to 3 months of age.
Yeah. And it can be tricky if you've been a swaddler to move to unswaddling. So something sometimes we did in our house was one arm out for a couple nights and both arms out and continue the tight around the chest.
And there's also bags you can get that their hands have a little bit more mobility. So that would be a good transition one as well.
Yeah, my 2-year-old's still in the sleep sack.
Yeah. So we want to talk about swaddling and its potential effect on breastfeeding. So in those few early days to weeks, we know how important skin to skin is on establishing milk supply and establishing latch. And so swaddling during those first few days to maybe a week may or may not be useful for you. Certainly during the day when you're just having that nice skin-to-skin tummy time, there's no need to swaddle. But if you're hoping to start getting your baby onto a bit of a routine and having a little bit of a nap time, you can certainly do some swaddling throughout to try and get a little bit of a longer nap out of them. But after that, we know that swaddling has no impact on long-term breastfeeding success. So feel free to swaddle as you see fit, and don't worry that it's going to impact your ability to breastfeed or your baby's ability to breastfeed.
Another question, an important point, is how swaddling helps infants sleep, period. So what we know from the evidence is that in general, infants who are swaddled arouse less and sleep longer. So we know that in quiet sleep, so deeper sleep, as well as the lighter sort of REM sleep, swaddling decreases startles in both of them. It also resulted in shorter arousal duration during REM sleep and more sort of consolidated, longer, deep sleeps for babies. So swaddling is good for sleep.
And if it's good for baby sleep, it's good for parent sleep. And really, we all need some sleep to be able to cope and manage the next day. So swaddling does improve baby sleep, and therefore probably does improve parent sleep, mental well-being as well. So we thought we'd go over some tips and tricks to help you have the safest swaddle you can if you choose to do this. So the number one tip is make sure you use a thin blanket or a thin swaddle sack. We need to dress our babies appropriately. And so the general rule of thumb is whatever you're wearing plus one layer. So think of that swaddle as the extra layer. So just making sure that you're being careful about what you use to swaddle. Now, if it's freezing cold out, there are some swaddle sacks that are a little bit warmer if you don't have proper heat in your house, and that's great to use instead of a blanket because we don't want any free-flowing blankets in the bed. But if you have a reasonably temperatured room, then just use a thin blanket or a thin swaddle sack to achieve that goal.
And the recommended temperature for sleeping for an infant is around a room that's 18 degrees or so. So probably a bit cooler than you're used to. And like Alicia said, those sleep sacks, I know I've had 3 babies and I was very obsessive about sleep. So I know a lot about these sleep sacks, is that they actually all have different, a lot of them have different thickness, and it will say on the label what temperature range those sleep sacks are good for. So that's something good to look at.
So the other important thing is making sure your baby, and we talked about this earlier, is on your back. We do not want babies to sleep on their belly if at all possible, especially if they're swaddled and especially if you're not right there with them. So we know some babies, especially those with reflux or heartburn, they do better on their stomachs. And so short naps when you're supervising them are probably okay, but certainly not swaddled. So if they're not going to be supervised, and if this is kind of a nighttime, they want to be swaddled on their back, not on their front.
Another thing you want to ensure is that the sleep surface or their mattress is firm. So we want a firm mattress, not soft bedding, and no loose blankets, no loose loveys, none of that stuff. So just a safe mattress and the tight swaddle up
No
top.
bumpers on the sides of the cribs. We don't want any of that in our beds, our baby's beds, I should say. This seems obvious, but we're just going to say it. Making sure your baby's mouth and nose are not covered. They need to breathe out of those areas, so if they're covered, they can't breathe. So just making sure when you swaddle them from their neck down. Don't include their head just in case it's not tight and they can move their head, their mouth and nose into that swaddle area.
The other thing, Alicia talked about earlier was hip dysplasia. And so what you want to make sure when you're swaddling is that it's nice and loose around the hips and that the baby can fully still extend her legs or his legs all the way. So we often make sure that, say the baby's this long, the swaddle probably goes down to here. So there's tons of extra room there for them to stretch their legs out. Even though those little babies, they're so cute. They have their knees up by their chest all the time, right? So don't swallow your baby swallow. So don't swaddle your baby based on how long they are when they're all tucked up. Make sure you leave lots of extra room for their legs and hips.
Yeah. And then the other thing is trying to get the right tightness or looseness is really important. So we want them to be nice and snug up top, but you still should be able to fit 2 fingers underneath your swaddle. So if that's the case and they're still loose enough that they can take full breaths, but if it's too loose and you're not using a sack, so if it's too loose and it's blanket, that blanket can come unraveled and then you have free bedding in the bed and they're unswaddled, which defeats the purpose on both accounts.
So what we're going to do is we'll link below to an Aiden and an A. It's one of our favorite baby brands. They make beautiful swaddling blankets. And they've actually got a really great video. And they've got great blankets that you can use that have a bit of a stretch and they're nice and light. So you can use them for swaddling. You can use them as a nursing cover-up. You use them with traveling. We'd take them out, put them down for a picnic, use them to cover the baby. You know, when you're out in the bright sun in the stroller, lots of uses for those blankets. And we'll link that below.
And then there's also a great document we'll put below that just has a step-by-step kind of pictorial guidance of how to swaddle as well if you're going to use a blanket. But like we said, there's also really easy solutions with zip-up ones and Velcro ones. So we'll put a bunch of options below so you can choose what you want. So just out of curiosity, we'd love to know that if you've had a baby, did you swaddle your baby and what did you use? What were the most useful things that you found? So if you did and you want to let us know, just make a comment below and that would be greatly appreciated. And just as a reminder, we do have a great website, www.shefoundhealth.ca. If you want more info on pregnancy, postpartum, newborn care, breastfeeding, we're coming up with new content every Wednesday morning, so keep an eye out for that, and you can sign up and join our community. Also, if you found this useful, we have an online prenatal course, so feel free to sign up for that, and you can do that on the website as well. Also, check out these few videos that are of similar content posted right here, and we hope you enjoy it.